Hi, my name is Cadence Chappie, and I'm going to be presenting on the Colorado tick fever for Dr. Cody's microbiology class for the fall of 2018. A short little overview of Colorado tick fever, or CTF, is that CTF is a viral disease spread by Rocky Mountain wood ticks. It is usually a mild disease that goes away within a week or two. It's very rare whenever it develops a case where the patient dies or has severe symptoms. CTF is not transmitted through person-to-person contact except for rare cases with blood transfusions, and there's only been one documented case where somebody contracted CTF through a blood transfusion. So, Rocky Mountain wood ticks, or Dermacentor andersoni, are the ticks that spread CTF, and they are usually found in the western United States and Canada. These ticks live at elevations between 4,000 and 10,000 feet. They are found in shrublands, along trails, and grasslands, and other places where most ticks live. Bites from female ticks can actually cause a temporary tick paralysis for about 24 to 48 hours after tick removal, and they typically take 2 to 3 years to complete their life cycles. So here's a little picture of all the different stages of the life cycle for Dermacentor andersoni. And so the nymph can sometimes infect with CTF, though it's usually the adult male and female. And as I said before, the females can actually cause tick paralysis for a short time. The geographic prevalence of CTF, as you can see, it is very concentrated on the western side of the United States, though there are a few cases, as you can see, on the eastern side. And CTF is not a nationally notifiable disease to the CDC. However, some states require that CTF cases are reported to their particular state health departments. So here's the ecology of the Colorado tick fever virus. As you can see, it shows a little life cycle of the Dermacentor andersoni, and they can infect humans as well as large animals like elk. And there's not really any information that shows if ticks who don't have the virus, whenever they come in contact with large animals that do, whether or not they get the virus that can then go on to infect other humans. But we do know that that happens whenever small rodents are bit by ticks that already have the virus. So the causative agent for CTF is a virus that belongs to the genus Cultivirus. The virus includes segmented double-stranded RNA with plus and minus strands that are collinear and complementary, about 27 to 29 kb. Virion morphology is non-enveloped icosahedral nucleocapsid symmetry with spherical particles which are about 80 nanometers in diameter. And here I have a little diagram of the structure of the virus. So for replication, the replication for the CTF virus is cytoplasmic. So it will attach to host receptors and mediates endocytosis of the virus into the host cell. Particles are then penetrating into the cytoplasm. dsRNA is never exposed to the cytoplasm, as early transcription of the dsRNA genome by viral polymerase occurs inside the subviral particle. Full-length plus strands from each of the dsRNA segments are synthesized. These are used as templates for translation. The positive RNAs are encapsulated into subviral particles. Then they are transcribed to give negative RNA molecules, which become base paired to produce dsRNA genomes. The capsid is assembled on the subviral particle. Mature virions are released following cell death and associated breakdown of host plasma membrane. So there are plenty of symptoms for CTF. The incubation period is from 1 to 14 days after the tick bite, and early symptoms include fever, headaches, chills, body aches, feeling tired, sore throat, vomiting, skin rash, and abdominal pain. About half of patients with CTF have biphasic fever, and what biphasic fever means is that they have several days of fever, and then they feel better for several days, and then they have a second short period of fever and illness. Most people recover completely, though some symptoms such as weakness and fatigue may last for weeks after. In rare cases, CTF will affect the central nervous systems, which will cause symptoms such as stiffness and confusion, and the stiffness is usually located in the neck. Even more rarely, a life-threatening infection occurs, and CTF can actually kill the patient. So there is no vaccine to prevent CTF, and the only way to prevent the infection is to take preventative measures against tick bites. And here I have a picture that I took of my family while we were on a hike, and as you can see, there's plenty of places that the ticks would be. So there's nice amounts of shrubbery off to the side, here and here. And then also, as you can see, we are all wearing long sleeves, long pants, and good shoes. And I know for a fact that none of us got a tick that day, which is nice. Though you should also, after you are finished with hiking through any kind of shrubbery or any place that ticks really like to be, you should go through your clothes to make sure there are no ticks that you aren't bringing back into your house. There are no medications that treat CTF, and if a person has a severe case of CTF, they may need to be hospitalized, as intravenous fluids can help as a treatment for the virus. The only medications that are really given to anybody other than being hospitalized are things such as Tylenol for pain relief and any kind of fever, regular medicines if you just have a typical fever. There is no specific CTF medications. And here are my references, and here's a picture of me looking out in Colorado and praying that I don't get Colorado tick fever, and I hope that none of y'all do as well. Thank you so much for your time, and I would love to answer all of your questions in class.